Hi, everyone. I'm Darlene Hutton with QRS Educational Services, and this is part 3 of a 7-part series called Airway Management. It's been designed for nurses, and in this video, we'll be looking at what we need to get ready to assist with intubation. As nurses, we will not be doing this skill, but many of you do work in environments in rural and remote settings where you have no RT services in your hospital. You may have one physician, they may be a locum, they may not be there 24/7. So it's really important to know what to prepare to assist with intubation. You need to go to your Airway cart or your crash cart and go through all of these letters to become familiar with these pieces. The S is to remind us to look at getting the suction ready and attached, stylet, syringe, stethoscope, and sedation. The L is laryngoscope and lubricant. O is that steady source of oxygen. P is the patient, position, and pressure. E, endotracheal tube and end-tidal CO2. I'm going to pause for a moment, going to get set up, and when we come back, I'll look at each of these in more detail. So let's talk about slope. You're doing this for a patient who is in respiratory arrest. You've called the physician stat, and you are anticipating that this patient will be needing to be intubated with an advanced airway. So while someone is taking care of the patient's ventilatory status, you need to go to the crash cart and look for all of those letters that we talked about in the acronym SLOPE. And of course, for all of these procedures, you will be donning your PPE. So the first S reminds us to get suction, and this needs to be attached to your suction canister. A lot of times patients will need to be suctioned as they are being intubated. Next is the stylet. Take it out of the wrapper, have it prepared. It's going to be curved on one end, straight on the other. Talk about what to do with that if it's required. You don't always get asked to put a stylet into the endotracheal tube. You need your stethoscope. You need your sedation. And for cardiac arrest, sedation is not required. So let's just review the 5 S's and syringes. Right, I knew I'd forgotten some S's. So we've got 3 different size syringes that will be on your airway cart or your crash cart for the airway management section. The smallest syringe here, that is good when intubating with an endotracheal tube. So you'll need that one only for endotracheal intubation. If it's a difficult airway management and the physician feels that they will not be successful or they don't want to attempt intubating with an endotracheal tube, then the LMA is the next likely advanced airway that most of you will use in a hospital environment. This size syringe here is perfect for inflating that cuff. For the King LT, which most of you do not have in your hospital as an airway option, this would be the syringe that is used. And King LTs are usually a pre-hospital type of advanced airway. So if you're in the emerge department, you may see a patient come in with a King LT in that situation. So those are the 5 S's. Let's take a look at the 2 L's. The first is the laryngoscope. Make sure you're comfortable taking the blade off and putting the blade on. It doesn't look like it's that difficult a task until you go to do it. You may be asked to change the blade size. So rummage around and see the different blade options. They're usually located on the side here. They'll say what type of blade they are. The secret to taking the blade off is the blade needs to be kind of floppy, and the thumb of the hand holding the handle is what is going to push the blade off. To put it on, you're going to align this loop right here with this little line here, align it, and then once it's aligned with your finger, you are going to push. And just ensure that there is a light source there. You will need lubricant, and water-soluble lubricant is what we use. The O is for oxygen. Let's talk about the 3 Ps. The first is the patient. So when you're doing the airway with an oral airway and the bag valve mask, if you have dentures in and they are giving a good seal, they're well fitting, then by all means keep those dentures in. But when it comes time to preparing to intubate, if there are dentures or loose teeth, make sure that they get taken out before intubation is started. In terms of position, it's really nice to have that head tilt chin lift to visualize the vocal cords. And so you may want to prepare ahead of time, get a towel or pillow to put under the nape of the neck if required. The last P has to do with pressure. We're talking about the application of cricoid pressure. It's not something that is used on a regular basis, but if it is going to be used, the physician will often take your hand, guide you on the patient's throat, do a couple of different maneuvers, and when they have the right spot, meaning when they can visualize the vocal cords, they will ask you to keep your hand in that position. Keep applying that pressure until they've asked you to let go of it. Let's look at the E now. There are 2 E's, the endotracheal tube. And for an adult, most sizes will range from 7 to 8.5. This one here is an 8.0. The decision will be made on the physician, and they may ask you to get the appropriate size. When you take it out of the wrapper, it's always prudent to take a look and make sure that there is no cuff leak before this gets inserted into the patient. To do that, take your small syringe and you want to put all of that air in and just ensure that there is no air leak. And then you want to make sure that all of the air is taken out. This needs to be completely deflated before inserting. Next is the end-tidal CO2. Most of you in the smaller hospitals don't have your crash carts equipped with continuous waveform capnography on all of your machines. So this colorimetric device helps us to determine that we are in the right location. Once the endotracheal tube is in place, kind of go through the motions here, we are going to take the mask off of our ambu bag. We are always going to have the filter next. And again, remember, there's no incorrect way to place this. Then we are going to place this device on top of the filter. Okay. And then we would attach our ambu bag here. So essentially what we will do once the endotracheal tube is in place is we are going to have our stethoscope out and we are going to do a 5-point check. We're going to insert air in and ensure that we do not hear air in the abdominal area. We will then give 2 further breaths while auscultating the left and the right anterior lung fields. And then we will give 2 more breaths to auscultate the left and the right side of the lateral lung fields. We're going to hear the air going in. We're going to see the chest rise. We know that that is one way to determine that the tube is in the correct placement. This is the other way to determine that it is in the correct spot. When you originally take this out of the wrapper, the inside part here is going to be purple. Once it's attached to the endotracheal tube and you've done your 5-point check and you are in the right location, the patient will now be exhaling carbon dioxide. That carbon dioxide will react to this paper and it will turn it from purple to yellow. So yellow is the color you want to go for, okay? But this is just a temporary strategy to confirm placement. It does not provide a continuous waveform or a continuous number. And so for that, what you're going to have to do at some point is you're going to have your proper monitor. You're going to take this off of the endotracheal tube. Okay. And you are going to insert this type of device. Okay. And then you would put your ambu bag or hook them up to the ventilator. This is going to end up going to your cardiac monitor, and you will end up with a continuous waveform capnography. If your patient has a heartbeat and it's a good, strong heartbeat, you should see a number ranging between 35 to 45 millimeters of mercury. If this patient is in a cardiac arrest and their heart is not beating and you are doing compressions, you should see a waveform number that is greater than 10. That indicates that you've got good compressions. I think that about covers it for slope, and we are going to have more videos put out looking at intubating with an endotracheal tube, a King LT, a laryngeal mask airway, and we are going to have a separate video just on waveform capnography. So if you found this video to be helpful, you know what to do, and please subscribe to my channel. Thank you so much.